All right, let's talk about pregnancy. Okay, including all parents in the pregnancy and birth discussion is important. It's not just women who can get pregnant. Anyone with a uterus can get pregnant. So I will attempt to be as inclusive as possible in my language. Menstruation. The pregnancy clock starts on the first day of the last period. So that's why at every appointment, they're going to say, when was the first day of your last period, to help track the pregnancy. So it is not at fertilization. Pregnancy officially starts at the first day of your last period. If you started bleeding on May 15th, May 15th is when your pregnancy started. Ovulation. So what occurs in ovulation? The mature egg bursts out of the ovary. Many people will feel that pain. And it enters the fallopian tube. So it bursts out of the ovary and it enters the fallopian tube. Then the egg begins to travel down the fallopian tube to the uterus. Fertilization usually happens in that first third of the fallopian tube. So if sperm are present and there has been ovulation on that side, there is a possibility of having fertilization occur. But there is a fertilization window, and I think this is important to understand. So we have ovulation, and there's a misconception that someone is only fertile when they are ovulating. Well, here's the reality. If you have unprotected sex up to 5 days before ovulation, sperm can survive in the uterus, the fallopian tubes, for up to 5 days. So if you ovulated on May 10th and had unprotected sex on May 6th, it's still possible to get pregnant. There's also a window after. So the egg can survive for 12 up to about 24 hours after ovulation. So you could have sex before ovulation or after ovulation and still get pregnant. So there's that window of time, okay? And that's important to understand when deciding, first, if you are choosing to get pregnant, and second, what methods you would use to prevent that pregnancy. So information is important. So it is not that you have to have sex, unprotected sex, at ovulation to get pregnant. There's a much bigger window than that. Once fertilization does occur, the fertilized egg is called a zygote. The zygote begins dividing and then it becomes an embryo. Around day 8 or 9, the embryo is going to implant inside the lining of the uterus. Now, some people may know when this happens, and there are some signs. So some possible implantation symptoms, you might have some light bleeding, so that might just be spotting. Some cramping, some nausea, some bloating, your breasts might be sore, you might have a headache, you might have mood swings, okay? What's happening? Well, not only is the embryo continuing to grow and develop, but the placenta is beginning to be formed. Okay, the placenta begins to form after implantation, and it's formed from a combination of tissue from the embryo and from the birthing parent. It will eventually weigh 1 to 1.5 pounds. So the person who is pregnant is growing a human being and growing a separate organ. So there's a lot that's happening during pregnancy. So how does the placenta form? Okay, so you can see as the embryo implants inside the wall of the uterus, the placenta begins to form from a combination of tissues. So you can see here, all right, we have implantation occurring. So full implantation, the embryo continues to grow and the placenta is beginning to be formed. Okay, so now the embryo is beginning to come out of the inside of the uterine wall. And here it is fully outside the uterine wall. But you can see here what remains is the amniotic sac, with this right here representing the amniotic fluid. So this is the placenta. Here is the umbilical cord, all of this forming. Here is the amniotic fluid. Here is the amniotic sac. Okay, so here's the placenta, which is attached to the wall of the uterus, the umbilical cord attaching to the fetus, which allows blood flow back and forth. Okay, and then we have the amniotic sac with the amniotic fluid inside. Okay, how long does it take for this to happen? So it takes about 11 weeks for the placenta to fully form. So how the heck does the embryo get nourishment before this? Well, glands in the wall of the uterus actually secrete nourishment. So mostly glycogen, which is what your liver stores for you, that eventually gets converted into glucose. Some researchers in some articles will refer to this as womb milk. It is not through the umbilical cord, not through the placenta. Literally, the walls of the uterus are providing the nutrients. What is important to know is that in the placenta, there is no mixing of fetal blood and parental blood. Now, things do cross back and forth. So nutrients go from the birthing parent to the fetus, and waste goes from the fetus back to the birthing parent. There are some diseases and illnesses that can cross that placental barrier, so things that can pass from the birthing parent to the fetus while the fetus is in utero. Things like drugs and alcohol are some of those things that will cross the barrier and could have an effect on the developing fetus while the birthing parent is pregnant. So how do you know if you are pregnant? The earliest signs that could occur before you miss your period would be tender, swollen in your chest area, be nauseous, increased urination, and fatigue. So these may occur before your pregnancy test, before you can even take a pregnancy test. So what is a pregnancy test? Well, a pregnancy test detects HCG. That stands for human chorionic gonadotropin. It's a hormone that begins to be produced around 6 days after fertilization. So there are a lot of options for pregnancy tests. You can get it from the dollar store. It's still testing the same thing. Okay, you don't need to buy the $12 pregnancy test. The dollar one is going to be just as effective. Okay, while the type of pregnancy test might not be important, when you take it is. So if you take it on the day you expected your period, the effectiveness is about 96%. If you wait until after your period was expected, so a day after, or 2 days or 3 days, the effectiveness does increase to 100%. If you were to take it 6 days before your period was expected, the effectiveness might only be 25%. A positive pregnancy test, though, does indicate the presence of HCG, which would indicate pregnancy. Besides a pregnancy test that you can get at the store, what are other ways to detect pregnancy? You can use a transvaginal ultrasound, or at a medical office, they might use a blood test. The blood test still detects HCG, but it's usually used to confirm a home test. Pregnancy is divided into trimesters and lasts 40 weeks. Remember, the zygote was the fertilized egg that began to divide, becomes an embryo around 8 weeks. When the basics for all organ systems are laid down, it becomes a fetus. After the fetus is birthed, then it would be a baby. So the first trimester, that's the first 3 months, the first about 1 to 12 weeks of pregnancy. You can see at 4 weeks, poppy seed tiny small, by 12 weeks about lime-sized. What are some first trimester milestones? Well, the fetus will weigh about an ounce at the end of week 12. Most of the major organ systems have begun to form. Fingers and toes are usually webbed still. There is cartilage being laid down in hands, in feet, and in limbs. The placenta, by the end of the first trimester, is now fully formed and functional. In the birthing parent, what are some first trimester possible symptoms? Breast tenderness, mood changes, nausea, vomiting, morning sickness, frequent urination. You might have weight gain or weight loss. And now you might have weight loss depending on how severe your morning sickness is. So that's something that's going to want to be monitored. You might have extreme fatigue, headaches, heartburn, pain in your lower back or pelvis. You might have food cravings. You might have constipation. A whole lot going on. In the second trimester, that's about 13 to 28 weeks, and depending on the source, it might be counted at 26 or 27 or 28 weeks, but it would be the second 3 months. So remember, we read a lime, so continuing to grow to about cauliflower size. What are some milestones? Well, the fetus will weigh about 2 to 4 pounds at the end of week 28. The bones begin to harden. So remember that cartilage that was laid down? So the bones begin to harden. The skin thickens. Hearing begins to develop. So we need bones in order to hear, for that signal to be transduced. So when the bones begin to harden, the fetus can hear. Eyelids can open and close. There are stronger kicks happening, and the digestive system is working. For the birthing parent, some symptoms in the second trimester could include carpal tunnel syndrome. There might be a line on the skin from the belly button to the pubic hairline. Could have patches of darker skin on your face. Again, still lower back or pelvic pain, darkening areola, the area around the nipple, and stretch marks typically begin to appear here. The third trimester would be the third 3 months from 29, or again, depending on when that cutoff is for second trimester, to 40 weeks. So from eggplant to watermelon, that's what is happening here. What are those milestones? Well, the eyes can sense changes in light. There's hair. The fetus can kick and grasp and stretch, but is also getting crowded. Bones harden more. The organ systems complete their development, and then fat is added, and this is added at the later stage of the third trimester. Okay, some third trimester symptoms: acid reflux, hemorrhoids, shortness of breath, breast tenderness, protruding belly button, difficulty sleeping, swelling, fingers, face, ankles. Also, practice contractions called Braxton Hicks. That does not mean they are not painful, they're just practice. So 40 weeks, that's how long pregnancy lasts. Remember, counted back to the first day of your last menstrual cycle beginning. The uterus, the top of the uterus or the fundus, will be measured at appointments. So you can see right here, at 8 weeks, the uterus is still very small. Somewhere between week 36 and week 40, the fetus usually drops. So the shape of the uterus kind of changes, okay? So what will usually happen from this pubic symphysis, a literal measuring tape will be used to measure how far into the fundus, the top of the uterus. And this is used to make sure that the fetus is growing appropriately, okay? So someone might be measuring consistently big or consistently small, but if that is consistent from appointment to appointment, it is less concerning than if all of a sudden there was a giant increase or a decrease or a very small increase. So those are the things that someone measuring will be looking for. So it is important to note that pregnancy does grow a human and an organ, the placenta, and this does take a toll on a pregnant person's body. There's weight gain. So 25 to 35 pounds on average. Most is in the abdomen, so this can shift the center of gravity and create some balance issues. It is not all growing the human being. So there's the weight from the uterus, fat, actual literal blood, breast tissue, amniotic fluid, the placenta. So there is a whole lot that goes into that weight gain. Something that's important to realize is as the fetus body is developing, calcium is absolutely essential for strong bones and a healthy heart. So calcium will be taken from the birthing parent's bones and teeth if there is an insufficient amount in the blood. That's why calcium is very important during pregnancy for the birthing parent. There can be stretch marks. They result from tears in the dermis. So that collagen in the dermis layer of the skin tears, resulting in stretch marks. So it's just that it cannot accommodate that growth. Okay. Lung function. Lung function actually improves during pregnancy. With each breath, a pregnant person inhales about 50% more air than someone who is not pregnant. There is some squashing of organs. So the lungs get pushed out of the way, the heart gets pushed out of the way, the digestive system, the bladder, lots of things get squashed. There's also a hormone called relaxin. And as the name suggests, it is to relax some tissue, specifically ligaments. Okay. And that's to prepare for birth so that the bones in the pelvis kind of wiggle a little bit to stretch to allow birth to happen. But this hormone is not specific. So it doesn't just relax the ligaments in the pelvic area. It relaxes muscles, joints, ligaments everywhere. So it can increase the risk for tears and sprains in the pregnant person. So it is relaxing broadly muscles, joints, and ligaments. And that is kind of a recap, a summary of pregnancy. I hope you learned something new today.